And right now we have Jenny here in our audience who has a question about this. So, Jenny, welcome.
Thank you. I had my baby 8 weeks ago. Yay.
Congratulations.
Wow. I'm looking at that and I'm just like, wow, that's really scary. I got the whooping cough vaccination in the hospital. My husband got it and my mother-in-law got it. But since she's been born, there have been a parade of visitors coming over and wanting to kiss her and touch her and hold her. And now I'm like, does everyone need to get the vaccination? Like, should I just have like a check at the door?
Yeah, right. Just have the shots at the door, right?
Right.
You know,
Well, and this is a great chance to talk about how vaccinations save lives, too.
exactly. You know, I applaud you for making sure everybody that's going to be around your new baby, dad, mom, grandparents, anybody, you know, frequently is getting the vaccination, because that's really important. Because with whooping cough, you know, a baby isn't protected from it until they've had 3 doses of the vaccine, and that doesn't happen until they're 6 months old.
Right.
All right. But it's the babies under 6 months old that are at highest risk for a severe case of whooping cough or pertussis. It's the same thing. But your question, should you have everybody that's ever going to hold your baby make sure they have the vaccine? You probably don't need to go that overboard. But this is something I tell my moms all the time. If somebody's going to hold your baby, make sure they don't have a cough or a cold. Make sure they've washed their hands with a hand sanitizer that you're going to keep in the diaper bag. And make sure they don't get too close face to face. That should be protection enough. But it's kind of a little bit ironic is that everybody actually should be getting a booster anyways. So
If
technically,
you're a new parent,
yeah.
for certain, and if you're around kids a lot, you should get the booster. It's called Tdap. And that tetanus, diphtheria, and pertussis. So in that one vaccination, you're protected against 3 different things. And we all know, okay, every 10 years I'm supposed to get a tetanus update. But this is a unique booster as an adult when childhood immunity wears off, assuming that you did receive the childhood vaccinations. And
you know, and one of the reasons why whooping cough is so common out there is because, like we saw in the PSA, the vaccine wears off. So as an adult or a teenager, you may just think you have a cold or maybe even bronchitis, and you're walking around spreading this for a few weeks before you finally get treatment. And then who knows who you've been exposed to. But then the baby gets what looks like a little cold at first, but then after a week or so, it starts to get worse. And they get these coughing fits, and they cough so hard. A lot of people don't, you know, they hear whooping cough, they're not scared of it. As a pediatrician and as ER doc, I've seen babies in the ICU that are coughing so hard that they can't breathe. They don't have time to breathe. And the baby is getting a lack of oxygen. And that's what causes either death or brain damage, because they don't get the oxygen to their brain.
I know, but you're doing great things, and one thing you can have at the door is hand sanitizer. And there actually has been a change by the CDC for pregnant women now as of June of 2011, or this year. They used to only recommend it for pregnant women after delivery, but now you can actually get it in the 2nd and 3rd trimester. And the reason for that is they believe that now it can impart some antibodies to the newborn. So that's going to be helpful. But you're going to be a fantastic mommy. Keep your baby safe.
thank you so much for being with us, and best of luck.
Thank you.